This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
All right, good day, ladies and gentlemen. Welcome to the latest episode of the Best Health Podcast with Wake Forest Baptist Health. Thanks for listening in today. We appreciate it. We have a great guest here with us, Chris Ina. He's the manager of our athletic training programs here at Wake Forest Baptist Health. So welcome, Chris. How's it going?
Good, Justin. Good to see you.
Yeah, thanks for joining us today. So we're going to talk a lot about back to school. So it's back to school time, which means we're ramped up for fall sports, right? So
Yep.
Practices for fall sports just recently started, and Chris is here to talk us through our athletic trainer agreements and partnerships that we have with multiple schools in the region, and also about our sports medicine program here at Wake Forest Baptist Health and the different types of services that we provide and tips and injury prevention ideas that we have through sports medicine as well. But before we jump into all that, Chris, just tell us a little bit about yourself, where you're from, and when did you wake up one day and say, I want to get into athletic training?
I don't know if that was what happened, but I'm from Ohio. Grew up outside of Cleveland. Went to college at University of Toledo.
Okay.
And then I went across country to California. I got my grad degree at Fresno State. And then drove cross country and wound up at Wake Forest for about 14 years. Worked a multitude of sports, but mainly football there.
Wake Forest, the university.
The
yeah. Demon Deacons.
Demon Deacons, that's
Yes.
right. So I worked football there for about 14 years. And then this opportunity came with the hospital to kind of develop and manage their outreach athletic training program. And it's something that interests me. And I got that job. And 3 years later, here I am.
Here you are. Just like yesterday.
Yeah. So I started out in PT school,
Okay.
like most athletic trainers do, I guess. And then you have to do rotations through clinics and get hours. And when I was doing my rotation through PT clinics and working with workers' compensation patients or total hip, total joint patients, that really didn't interest me much. But when I worked with athletic population, that really seemed to fit me better. So then I just asked around and say, what other jobs can we do working with athletes? And that's kind of how I stumbled on athletic training, and here I sit again.
There you go.
Yeah.
All right, cool. So we'll be talking a lot about student athletes today, and there are parents that are listening to this where their kids, their students have been playing sports for years and years and years, and they're pretty well adept to the system. And then there's maybe parents that this is going to be their first year with their students playing organized sports. And throughout the community, we work with, to some degree, local youth sports organizations, and then we also work with various school systems here in the area. So, Chris, just tell us a little bit about our athletic training program here at Wake Forest Baptist Health and the different partnerships that we do have.
Sure. So about 3 years ago, Winston-Salem Forsyth County Schools was interested in putting an athletic trainer in each school in their district. And they were really looking for a medical center to really kind of flagship that and partner with to really provide those athletic trainers. School budgets are tight, so they were looking to kind of offload some of the expense and still have services. So we partnered with the Forsyth County Schools to provide them a contracted athletic trainer to each school. So that was kind of the first step. So from there, it's just grown and grown and grown. And the more school districts find out about our program, and especially parents, when parents find out that, kids that go to Winston-Salem Forsyth County Schools that play sports have this medical person at school every day on the sidelines at football games and basketball games and all events, they start asking those questions to their school saying, how come we don't have that? Okay. And then those calls end up coming into us. And then that's kind of how new partnerships tend to develop and grow, more from like a need basis and a want basis. So that's kind of where our program is, and we started with 12, and now we're up to 24 high schools in the region here.
So we have Winston-Salem Forsyth County Schools that we partner with, and then who else do we partner with that gets up to the 24 schools?
So we have one school in Davidson County, Lexington City Schools.
Okay.
So we go all the way down south, and then when we move west, we have we just started with Yadkin County Schools.
Nice.
And now we have Wilkes County Schools. And then moving into the east side, we got some schools in High Point and Guilford County, about 4 schools in that region.
Nice. So with those partnerships, you did point out that the athletic trainer is assigned to each of those schools. And so when they're there on site at the schools, and if parents are listening to this, give us an idea of what they're doing at the schools. How are they interacting with the coaches, the students? Maybe some parents or anyone who's been to a game before sees a trainer on the sideline, but it's much more involved than, hey, just showing up for a game and sitting on the sideline, right?
Right, absolutely. And I think one of the things that differs our program from other programs is our athletic trainers are at the school every single day. Okay. Some programs just provide athletic trainers just for football season. That's not what we do. Our staff is there every single day throughout the school year, including summers, because as we know, sports never stop anymore. Yes. Kids are always working out, always conditioning, so our staff is always there. And another unique part is they're assigned to that school. So they're not floating between a couple different schools, one day here, one day there. Like when you get an athletic trainer from Wake Forest Baptist Health, that's your athletic trainer. Gotcha. So that athletic trainer, they probably roll into school around noon, 1 o'clock. They set up for practices, get the water stations ready, and anything else they need to do to get ready for practice. Mm-hmm. They got paperwork and injury reports to do. If kids have time, they come in and do a little rehab, maybe between classes or during lunchtime or something like that. And immediately when school's over, that's when everything kicks into high gear. Practices start, games start. So then they're out on those fields, caring for those athletes. And then when practices and games are over, they clean up and leave for the day. So they're putting a good 8 hours in there every day. But with them being there every single day, that's how you build those relationships with the kids. The kids notice you're there every day for them, and they see you not just at football games. They see you at the volleyball match, or they see you at the tennis match or something like that. And then the coaches notice too, because again, you're covering their sport as well as football. Sure. So then you start to build those relationships, and as time goes on, you see those kids when they're a freshman all the way to a senior, and then the next group comes in, and like you were saying, that kid, the senior, maybe his brother is now in the school, and those parents are already familiar with you, so they know the kind of care that you're going to provide for their son or daughter throughout school. So it's that consistency is a really big piece to our program.
Yeah, that sounds great. So with them being there with the student athletes, obviously if they're at all the practices, all the games, they're there when a student does get injured, and injuries happen sometimes. Mm-hmm. So maybe just describe for people listening what would happen. I guess walk us through the process of we see someone, a student get hurt on the field, right? So then we see the trainer go out there and do the initial assessment. So talk to us about that from that time period through additional evaluation on the sideline, and then maybe getting them into the clinic, sports medicine clinic, or doing rehab. Just walk us through how athletic trainers might go through that process.
Sure. Again, being there every day for all those events, we're like that first line of defense. So, again, being there, so we see that kid get injured, we see them twist their ankle or hurt their knee. Yep. So we see that mechanism of injury, so that gives us a good idea of kind of what's going on. Okay. We do that initial evaluation, and at that point, the athletic trainer is really good at triaging that. Is this an injury that really needs to be seen by a physician, or is it something that they can handle and rehab themselves and see if they can get that kid back to playing as fast as possible? So at that point is when they make that, that decision. And a lot of times they might make that decision and a week later the kid, is really not responding or not getting well quick enough. And then that's when that referral might be like, well, let's go see a physician now, rather than some schools without an athletic trainer, all those type injuries get directed straight to the emergency department.
Oh.
And that's really not where they need to be.
Sure.
That's a cost to the parents.
Sure.
So that's something that the athletic trainer can kind of navigate and really hopefully save time and money for the parents, kind of deciding like what can we do here with this injury.
I got you.
They have the facilities at the schools where they're able to do some of that rehab. And they all know their limitations. Like if they just can't, they don't have the facility, they don't have the space, they don't have the time, then of course they're going to say, look, I'm just not equipped to do this. Let's go get checked out by a physician and get some proper rehabilitation.
Gotcha. Well, I'm glad you mentioned physician. So if I'm not mistaken, each school that we partner with, or I guess any time where our athletic trainers are out at an event, whether it's a local high school or some other organization or event that we are providing coverage for, there is a physician that is linked to that athletic trainer. Mm-hmm. And that is part of our structure here at Wake Forest Baptist Health. So I guess speak to that relationship real quick between the athletic trainer and the team physician, and how that team physician is there as an additional resource for each school or each organization we work with.
Sure. In order to be an athletic trainer in North Carolina, you have to have a license. And to obtain a license, you have to work underneath the direction of a physician. Mm-hmm. So that's an easy, connect the dot game that we play here with our athletic trainers and our physicians. So that's number one. We can't practice without supervision from a team or from a physician.
Sure.
And with each school having their own, again, consistent team physician or team doctor, that athletic trainer always has someone that they can, give a call, ask some questions, refer an athlete out over to see them in clinic. If an athlete does go see them in clinic, they can pick up the phone right away and say, hey, what did you think? Because sometimes getting information back when a kid goes to a doctor from a 14 to 16 or 18-year-old is the message gets lost.
Sure.
So it's easy for them just to pick up the phone and just call them or shoot them a text message or something like that, and get some additional information. So that partnership is really important.
Yeah.
And with the physician, with cooperation from the physicians, again, it takes time out of their schedule. They're on sidelines of a lot of the football games on Friday nights. So having their willingness to volunteer their time to the schools, really makes this program successful.
That's really good information. So wanted to touch base on kind of one of the hot button topics, if you will. So there seems to be a lot of national attention and regional and local attention on concussions. So there's a lot of information on the internet about concussions. Mm-hmm. Parents, obviously, and rightly so, are it's on their minds and they're thinking about it and wondering, asking questions. So I guess just give us a brief overview of how our athletic trainers and our physicians here at Wake Forest Baptist work with concussions, I guess on the front end, hopefully helping prevent them. But if a student does sustain a concussion or they think there could be a suspected concussion, walk us through that process with what the athletic trainer and the team physician would do.
Mm-hmm. So from a prevention standpoint, when you think concussion, you think football, right? But not all concussions happen in football.
Yes.
Soccer has a high concussion rate also.
Yes.
Cheerleading, believe it or not, has a high concussion rate.
Interesting.
Especially when they're stunting,
Yeah.
falling off those pyramids and whatnot.
That makes sense.
So let's not just pigeonhole concussions into football.
Sure.
Obviously, that's a big one, but not the only one.
Sure.
So when it comes to a prevention standpoint, the athletic trainers are at football practice every day. Maybe there's a drill being done that, technique might be wrong. Something might look like it could predispose those kids to maybe, in a concussion event. So that's where they can kind of maybe talk to the coach and say, hey, we've had a couple kids run through this and, they're coming out with concussions, and maybe you should modify this drill or something like that. So that's one way we can help with prevention. But the other way is we really help with education. And research has shown that the sooner you recognize a concussion and start to treat it, the quicker that the student athlete kind of heals or bounces back and gets back to playing. And that's a message that we get across to all parents and all kids, because there's always this stigma attached to concussions. Like if you're an athlete, you don't want to admit that you have a concussion because it might make you look weak, or like you don't want to play or something like that. But as soon as they realize, that if they recognize that concussion quickly, rather than try to hide it for a week or two, and then the symptoms are going to get worse and worse and worse, and they're going to end up missing actually more time if they would have just come to us at the beginning and say, hey, I don't feel well, I feel dizzy or nauseous or whatnot. Then they can start getting treatment quickly. And as soon as the athletic trainers recognize a concussion, we have some testing, some cognitive testing that we do to help. Concussions there's no one test to say you have a concussion. You can't get a blood test. You can't get a brain scan to say you have a concussion. So there's no definitive test for a concussion. It's very symptom based. So they kind of run through their symptom score, their symptom test. And at that point, if they recognize they have a concussion, then we refer them to one of our concussion physicians. And then that's kind of when they start that protocol to get back on the field. Gotcha. And a lot of that protocol is done at school with the athletic trainer. Okay. It doesn't require additional physician visits or anything like that. Okay. The athletic trainer is well trained to kind of handle and run that protocol under the direction of the physician.
Sure, and they're helped to guide them back to their return to play status.
Correct, yeah. And there's a return to learn component now, which kind of they get some school modifications. Okay. Because the mental part of the concussion, your brain's still trying to work, but it's not working efficiently. Yeah. So modifying some school tends to help recovery also. Whether that's a half day of school, maybe it's not doing testing, maybe it's sitting in the front row of the class rather than in the back row or something like that, to give those kids a little bit of a break and give their brain a little bit of a break so it can heal. Yeah.
One other top specific treatment or other topic that I wanted to talk about that seems to be getting some attention right now, just because it's still during the warm months, is hydration or dehydration, or proper hydration. So it is warm, and if you're in organized sports and you're outside, you're definitely going to be sweating a lot and losing a lot of fluids. But this is good information, even if you're just going out for a hike or going out bike riding on a trail during these warm months. There's this idea of staying properly hydrated and consuming enough water. And I guess people, they sometimes dismiss that. Oh yeah, okay, drink some water, sure, fine. But really talk to us about what that does to the body when it's not getting the proper amount of water, and why it's so important to plan ahead for staying hydrated. So if you're going to be outside participating in an activity for a long time, maybe, as you're walking out onto the field is not the time to start drinking fluids and hydrating. Correct. Yeah. So talk to us a little bit about that.
Right. So when you sweat, you're not just losing fluid, you're losing, you lose salt. So if you ever tasted your sweat, it tastes salty. Yeah. Or you watch baseball players, they have their hat on, they have that like little white ring on their hat on the outside, because that's all the salt that you sweat out. Yes. So that's an electrolyte. So losing that electrolyte, that's what really is going to affect your performance. And they said, if you lose 2% of your electrolyte balance, it really affects your athletic performance.
Interesting.
So, that's where Gatorade makes all their money, right? So that's what they put into Gatorade, is that salt, that electrolyte, that carbohydrate that gives you a little bit of energy. Sure. So if you're thirsty, what they always say is, you're thirsty, you're already dehydrated. So don't use thirst as your main reason to drink some water.
Yeah, that's interesting.
So what we always tell our athletes is you need to hydrate before your game, at least an hour before. Drink a bottle of water, bottle of Gatorade. Then continue to hydrate during competition, as best you can. and then definitely after. Don't just say, oh, game's over, I'm good to go. You need to keep hydrating after. So if you use that before, during, and after kind of philosophy, it should help you stay hydrated for that event. And when everyone knows when you're dehydrated, that's when you get those muscle cramps, you get the headache, you get that fatigue. So no one wants to play any type of sport, ride a bike, run a marathon when they have a headache or they're feeling tired. So that's why hydration is a key. And there's also research out there, if you're into research nerd like I am, that when you're dehydrated, you're more likely to pull a muscle. You're more likely to sprain your ankle.
Gotcha.
Because your body's just not at full strength.
Yeah. It
It doesn't have that full control. So you're a little bit more likely to maybe catch an injury rather than if you're just properly hydrated. So yes, hydration is very important. Not just in the heat too. It's almost more important when you're in the colder months, because you're not sweating and you're not losing all that fluid, but you still need to be hydrated well to perform.
Yeah, that's great info. And there, I'll do one of my shameless plugs here. So there's lots of information about hydration and stretching and nutrition on our sports medicine guide, and we update it each year. So the new one just came out on our website. So if you go to wakehealth.edu/sportsmedicine, you can download our sports medicine guide with lots of great tips in there. You may or may not see Chris's picture in there.
Better be in there.
Extra bonus. I want to transition a little bit, and we're getting close to wrapping up, but if someone's in organized sports, a youth sport or an adult rec league, or they're not in organized sports, they're out riding their bike on a trail, or they're up in the mountains hiking, and they sustain an injury. Heck, I've sustained an injury, walking up a few steps and injured my foot before. So I guess talk to us a little bit about some of the services available at our sports medicine clinics. So you spend some of your time at one of our sports medicine clinics here in the Triad. So talk to us a little bit about the providers there and a lot of, I guess, some of the common injuries or issues that you see come through the sports medicine clinic.
Sure. Our sports medicine Stratford location is I would say, one of our flagship locations. We really try to dedicate it to sports and sports injuries. We have sports trained orthopedic physicians, we have sports trained family practitioners, we have sports trained PAs there also. We really focus on the athlete at our facility. We also have a full physical therapy department that does, obviously our sports rehab. Sure. We have a nice little indoor turf area that we can do a lot of return to play activities. We're also attached with Chris Paul's Basketball Academy, and nice. We're able to use their basketball courts when necessary for, any type of return to play for like a basketball player, a volleyball player or something, to get that court experience. But having that facility available to anybody in the community, weekend warriors, mud runners, marathoners, golfers, that's why we work perfect partnership with the high schools, because that's our target is that student athlete or the athlete. It's a perfect facility for them to kind of come in and see a sports doctor and get a proper evaluation and a proper plan for returning to whatever activity they want to return to.
Gotcha.
One of the nice things too we offer is same day, next day service.
Yeah.
So if you do call for an appointment, you don't have to wait 2 weeks to see an orthopedist. Many times you might even be able to be seen that day or within the next couple days, if not the next day.
Yeah, speaking from personal experience, that is a huge help when your foot is hurting or your knee is hurting. Getting there and getting seen that same day or the next day, it just helps getting on the road to recovery as soon as possible.
True. Athletes have a different mentality. They want to get back. They want to get ready. They want to get better as fast as possible. So waiting 2 weeks to see a physician when your knee's hurting really isn't the greatest answer to a true athlete.
Sure. I appreciate you taking the time with us today, Chris. This is awesome information. As School's getting ready to ramp back up, and fall sports are ramping up, and we're still towards the end of summer and getting ready for fall. So there's lots of activity, people being active outdoors, either in organized sports or outside of organized sports. So this has been a great overview of our partnership with our athletic trainers, and also some just good information on concussions and hydration and what our sports medicine program can provide for anyone in the community. Mm-hmm. And I know you mentioned Sports Med Stratford, which is a great location, but I just want to let everyone know we do have, I think, total orthopedic and sports medicine locations across the region now. We're up to about 25 locations. So we have locations from Wilkesboro down into the Triad, of course, Greensboro, Winston, High Point, and down into Asheboro as well. So I encourage anyone, if they're having a strain, a pull muscle, a sore ankle, a sore hand, sore knee, anything, if something's preventing you, I think Dr. Thornton or Dr. Coates maybe told me this, if it's preventing you from what you normally do or would like to do, then maybe it's time to pick up the phone and make an appointment. Mm-hmm. So 716-WAKE is our number you can call and make an appointment. You can also go to wakehealth.edu/sportsmedicine, and there's information about all of our locations and how to make an appointment there. And I'll give one last plug to download our all new updated sports medicine guide on that website as well. And Chris, I hope you come back and visit with us sometime soon. Maybe when we get into winter sports, you can come back and visit with us.
Sure, no problem. And I encourage all parents out there listening, if your school has an athletic trainer, seek them out, meet them, talk to them so you know who they are and you get to know them, because they're a very important part of athletics and a very important part of the health and safety of your child. And if your school doesn't have an athletic trainer, you got to get on those administrators and ask those questions. Why don't we have one?
There you go.
And call Wake Forest Baptist Health, and we'll see what we can do.
That's right. Great info, Chris. I appreciate the time today. Hey, everyone out there listening, thank you for your time, and I hope you come back and listen to us again soon. This is Justin Gomez with Wake Forest Baptist Health. Have a good day.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.